The 1-minute preceptor technique was developed to be a fast and effective way for clinician educators to deliver formative feedback while supporting a learner's autonomy. To incorporate the 1-minute preceptor into your daily routine, let's explore the 5 micro skills that will guide you in applying this approach with your residents. The first step is to get a commitment. This is accomplished by asking, "What do you think is going on?" and then waiting for the learner to provide you with their opinion. Resist the urge to interrupt the learner, and resist using nonverbal cues to lead the learner to a conclusion. By involving the learner in the process, the preceptor gains insight into their learning needs, which ensure that teaching is targeted and effective. This collaborative approach enhances the learner's engagement and sense of responsibility in patient care. Do. What do you think is going on? Don't. This is obviously. Step 2 is to probe for supporting evidence. Ask them for the evidence supporting their opinion and explore other options they are considering. This step uncovers the basis for the resident's decision. Was it a guess, or was it based on a reasonable foundation of knowledge? The learner's response establishes their readiness and level of competency. Do. What were the major findings that led you to your conclusion? Don't. I don't think this is infectious mono. Don't you have any other ideas? Step 3 is to teach a general rule. This is your opportunity to pull out the key message from the patient encounter. During this step, keep information to general concepts or principles, avoiding lengthy discussions or anecdotes. Residents will apply what is shared to future experiences. Residents tend to recall guiding principles, and often the individual patient may serve as a cue to recall a general rule that was taught. One option here is to say, "I liked what you did. I would like it even more if you," then give additional context to what the resident missed or needs improvement on. Don't teach a general rule just to complete the step. Skip this step if the learner already knows general principles. Do. If the patient only has cellulitis, incision and drainage is not possible. You have to wait until the area becomes fluctuant to drain it. Don't. In this case, it's a good idea to soak the affected area to relieve the tenderness rather than lancing it. Don't overwhelm your learner with too many rules at a time. Less is more. Step 4 is to reinforce what was done well. The resident might not realize they have done something well. Positive feedback reinforces desired behaviors, knowledge, skills, or attitudes. Do. Thanks for volunteering for the selection committee. Now I don't have to pick someone and wonder about their commitment to the job. Don't say, "You are doing great." This is too vague and does not give context to the learner on what they did well. Step 5 is to correct mistakes. Just as it is important for the learner to hear what they have done well, it is equally important to tell them what areas need improvement. Provide feedback for only 1 or 2 points at a time in order to not overwhelm the learner. Approach the resident respectfully while concurrently addressing areas of need and improvement. Without timely feedback, it is difficult to improve. If mistakes are not pointed out, residents may never discover that they are making these errors and subsequently repeat them. In framing these comments, it is helpful to avoid judgmental terms such as bad or poor. Expressions such as not best or it is preferred may carry less of a negative value judgment while getting the point across. Comments should also be as specific as possible to the situation, identifying specific behaviors that could be improved upon in the future. To further support your residents' autonomy, ask them, is there anything you have learned now that you would do differently next time? This allows them to think through the correct answer. Do. You may be right that this child's symptoms are probably due to a viral upper respiratory infection, but you can't be sure it isn't otitis media unless you've examined the ears. Don't. Avoid vague, judgmental statements. You did what? As we wrap up this series on the 1-minute preceptor model, let's take a moment to remember the key steps that make the most of this powerful approach. The steps for 1-minute preceptor are to get a commitment, probe for supporting evidence, teach general rules, reinforce what was right, and correct mistakes. Thank you for tuning in. Up next, we have the 1-minute preceptor in action. Join us as we build on what we just discovered through a scenario practice. Do you want more resources on the 1-minute preceptor technique? Scan these QR codes for more information.